Hey everybody, this is Dr. Ben Pearl with FitFootU. Today we're in Alaska on the hiking trail. We had a little injury yesterday, a mild ankle or foot sprain. We'll get into the nature of the sprain, but there's a lot of debate about what is the best way to splint or tape an injury. We're gonna get right down to it. You have kinesiology tape, of which there are two major brands. There is KT tape, which is a very good option, readily available at most drugstores and on Amazon. That is a cotton-based tape that will allow some support. It does have a little bit of give, but not a lot. It's more of a therapeutic, but can be used for athletic activities as long as they are not too rigorous and as long as you are not sweating too much. In this case today, we are taking a more mild hike, so that is an acceptable solution. The other solution of the kinesiology tapes is rock tape. Very trendy, very popular, and very effective. It will provide a nice moisture seal. It is a more premium tape, a little more expensive, but it also adheres better, allows a little bit more stretch, and because of its adhesiveness, I find it to be superior for more heavy athletic activities or more heavy hikes that are going to require that you have something that keep you a little bit more dry that will adhere to your skin. The third option is the old school athletic tape. The nice thing about athletic tape is that that is also accessible, although the one thing about athletic tape that you must understand is it is more limiting than both of the two tapes that we previously described, and if you get it right on the front seam of your ankle, it can provide a little bit of irritation. This is why in sports like football that are more straight ahead with cuts that don't involve a lot of up-down motion and turning your ankle quite as much, white athletic tape for injuries can be a very good option. We're going to take a look at how to apply the KT tape next. What sustained was on the ATF ligament, the anterior talofibular ligament, attaches the talus, which is right here, to the fibula. The other ligament that was strained, and it works like a clock, and in this case we're going counterclockwise, is the calcaneofibular ligament. So this ligament also was strained, and there's not a lot of swelling because this is the next day, and we already did some icing and elevation prior. Also, the nice thing about the kinesio tape is that it provides a little bit of compression, mild compression, so that if there is any swelling, and what I'm doing is I'm trying to sort of simulate the directional pull of the ligament to provide stability. And now we're going to take our next kinesio tape strap and we're going to just reinforce that same ligament direction to achieve a little bit more stability. And we're going to go in the opposite direction of an inversion sprain. So we're going to slightly go in an eversion direction, or turning the foot towards the big toe dropping. Now, once we've got our two side straps here, we're going to use what's called an ankle strap. And the ankle strap is just going to enclose the straps that we've already put on the ankle. So let's go for our next one here. The other key to remember is that just because you have this strap doesn't mean you can't not assess how you're doing in the middle of the hike. So what I'm going to do here right now is I'm just going to do a retention strap going almost basket weave style in the opposite direction, perpendicular to what we just did, to lock these in a little bit more. Now, if you look here, we've got a little wrinkle on the bottom, and you want to make sure that you get the wrinkles out, or you will have blisters. So right now, I'm just reinforcing what we already did and making sure that we don't have any wrinkles, which will mess up the good work that we've done. How long can you leave these on? Generally, a tape with a light hike or a moderate hike, you'll get at least a day out of it. If it's an athletic event, by halftime that tape will probably be shot and you'll have to retape at halftime. Here's a close-up of what the KT tape with a Coflex outer covering to provide greater adherence. So Coflex is yet another thing that you can use just to anchor it in a little bit more so the strips of KT tape will not unfurl as you go through your hike or your athletic activity. Are you ready for the trail now, Joy?
Ready.